This morning, I got a hot topic that we're going to be talking about. It's the Hollywood beauty secret out there. We're going to be talking about DermaRoller, how it can help with skin rejuvenation, acne scars, stretch marks, fine lines. I have Dr. Robert Seek. He's a PharmD. He's also the medical science liaison for DermaRoller. Welcome, Robert.
Well, good morning. Thank you for having me on.
The statistics have shown that people that go to have surgical procedures done have actually declined. And really what people are looking for is a really minimally invasive, non-surgical procedure, cost but is still effective in treatment. Look at the increase in the amount of Botox, Dysport, fillers, even chemical peels, even some of the laser treatments out there. And I want my listeners to know, Robert, the things out there that we can offer them that they don't have to go and be down a week, have a facelift done, kind of smooth out them fine lines out there. And this treatment we've started over at Vitality Medical and Wellness Center, and it's called DermaRoller. Let's talk a little bit about it. It's a microneedling. It's originally from Europe. So tell us a little bit about the DermaRoller and its history.
Well, you're right. The DermaRoller is a German-made device. It is the only patented skin rejuvenation device that employs microneedling technology in Europe, and it's the only microneedling technology that actually has clinical data behind it, which is why the Europe's equivalent of the FDA, the EMEA, has approved it. It's a relatively new device in the United States, and it started to gain a lot of popularity after a Hello magazine article that featured some nice Hollywood and LA-based celebs that were calling on what they called Botox backlash. And it wasn't against Botox. What it was a number of Hollywood celebrities who said, I want my skin to look younger, but I don't necessarily want to have long downtime from very harsh chemical peels, from lasers or surgeries. So things like Botox, which give a nice, soft, naturally youthful appearance, and also the DermaRoller go hand in hand. You basically have a 30-minute procedure that engages what we call collagen induction therapy. So to look more youthful, we want the skin to be even in tone, we want to thicken the epidermis, and we want to do that with as little damage as possible that you talked about, and that's what's made the DermaRoller so popular that since its introduction in Europe in 2005, there have been over 1.5 million procedures, so it's a very safe procedure.
Now in today's world, people don't want to take off 1 week, 2 weeks to have a procedure done, and with this treatment, you don't have to do that at all. So I wanted something that could really add because, as everybody knows, I do family practice, and I also try to add that wellness preventative aspect to it. And we're providing Botox, we're putting in fillers, but what can we really do to help people stimulate collagen, whereas you really don't get that with a laser treatment at all. They're taking that top layer off the skin, you get that nice fine glow, but it's not really going down to that dermal layer where you get the collagen induction therapy. And to prevent and build collagen to add to the fillers and Botox in my own practice. And the treatment, you're going to have no downtime really. You look like a little bit of a sunburn afterwards.
But the difference when you use microneedling technology with the DermaRoller is we can go twice the depth that we can using the DermaRoller as we do with the laser. And the fact that no serious heat is applied means that we are not going to thin the epidermis. Lasers will. And it's actually Harvard School of Dermatology that has proven this in numerous articles. Not only can your epidermis become thinner after a series of laser procedures by 30%, that you can actually incur DNA damage that you won't see. And if you think about it, what is the laser? It's nothing more than very, very concentrated light. And for decades now, we've heard dermatologists tell us, well, to maintain a youthful appearance of your skin, stay out of the harsh sunlight or at least be protected. And we flip that upside down when we take this very harsh laser and concentrate that energy in a big way to blast away cells and create huge pits or these holes in the skin. And that's what we look at under the microscope. So here's two key differences that I show when I train physicians on this procedure. The laser will cause a hole, and the hole looks very wide at the top and narrow at the bottom, almost like a bomb went off. So you have a lot of skin that is lost, and that's one of the reasons why the downtime after a harsh laser procedure is so long. With the DermaRoller, you don't have all that epidermal loss. You have just a very neat surgical hole with the thinnest needles that are available on the market, and they're very sharp, so you don't feel them once you have the anesthesia gel put on, and you don't have any blasting away of the skin. Now, what's hard to see on the microscope biopsy slides is basically you have burnt necrotic tissue from the lasers. So what we want is we want more collagen produced. We want as much collagen produced as possible, and we want to thicken the epidermis. Now, one thing lasers will do is they basically take wrinkly skin, and they often do make it look better. okay, better than being wrinkly. But I've seen a number of patients who've had several laser procedures where the skin just doesn't look like it has a lot of life to it. It's smoother than being wrinkled, and yes, it looks better, but why doesn't it look youthful like a 25-year-old's? And that's because of the blood supply and the thick epidermis that you get from microneedling that you might not necessarily get from the lasers. So there are advantages to both. I'm a fan of the microneedling technology because I'm not causing the DNA damage. I think it gives a much better appearance. And the reason why there's no downtime is there's no burnt tissue that falls off and DNA damage because that heat, that strong heat from the laser, actually delays healing. So you don't even have healing until you get all of the burnt cells out of the way, which can take a week, and then healing starts. But with microneedling technology, since there's no extraordinary heat applied, the healing starts right away and the healing is more profound, and I personally think the results are better.